Welcome to the American Indian and Alaska Native Behavioral Health webinar series, presented by the National American Indian and Alaska Native Addiction Technology Transfer Center. I am Kate Trams, and I will be administering today's webinar. Today, Dr. Dan Dickerson will be presenting Combining Traditional Healing and Motivational Interviewing for American Indian and Alaska Native Urban Adolescent Prevention. This training series is brought to you by the National American Indian and Alaska Native Addiction Technology Transfer Center, or ATTC. We are one of 4 national focus centers which serve the ATTC network. The ATTC network also includes 10 regional centers and a network coordinating office. To learn more about our center, the network, or your regional center, please visit our website. Our next webinar in this series is scheduled for Wednesday, August 6th, when Dr. David Burgraff and Harrison Jim will present Integration of Western and Traditional Approaches to Healing. We also offer the Essential Substance Abuse Skills webinar series each month. The next session in the series will be held on July 16, when Matt Ignacio will present Group Counseling. For more information on our webinar series, you can contact me at the email address or phone number provided on this slide. Our center is a NADAC certified educational provider, and we'd be happy to provide you with CEHs for a $15 fee. The CEH request form is available for download in the Files pod in the webinar screen. I will also be sending this form in a follow-up email to all who attend it. Immediately following today's webinar, you will be redirected to our GPRA evaluation. GPRA stands for the Government Performance and Results Act, and SAMHSA asks us to evaluate our events in order to comply with this act and provide improved performance assessment and accountability. This survey asks about your satisfaction with the event and will take less than 10 minutes to complete. We thank you in advance for helping us to improve our programs. Before we start today's session, I'd like to go over a few instructions for the Adobe Connect system. To view the presentation in full screen mode, click on the full screen button at the top right corner of the presentation pod, which looks like 4 arrows pointing outward. To return to the regular view, click the button again. You'll be muted for the duration of this webinar. Please use the Q&A pod to share your questions and comments, and we will address the questions at appropriate points during the presentation. We would also like you to be aware that this webinar records participant attention time. If you minimize the webinar or are working in another window, the system will record your participation as inactive, which may be reflected in the number of CEHs received. The opinions expressed in this presentation are those of the presenter and do not necessarily reflect the official position of CSAT, SAMHSA, or the U.S. Department of Health and Human Services. Today's webinar is presented by Dr. Dan Dickerson. Dr. Dickerson is an addiction psychiatrist at UCLA's Integrated Substance Abuse Programs and also at the United American Indian Involvement in Los Angeles. His research is focused on substance abuse and HIV among American Indians and Alaska Natives, as well as the development of culturally relevant substance abuse treatments for these communities, including his study on motivational interviewing and culture for urban Native American youth, funded by the National Institute of Alcohol Abuse and Alcoholism and the National Institute of Drug Abuse. Thank you so much for joining us today, Dr. Dickerson, and I will pass things over to you at this time.
Yes, thank you so much, Kate. Yeah, I'd like to thank the Native American ATTC for this opportunity to present on our new and exciting research project, which is entitled Motivational Interviewing and Culture for Urban Native American Youth, or MICUNAY. I'm the co-principal investigator on this project, and I like to especially acknowledge Elizabeth D'Amico, um, our co-principal investigator on this project from the RAND Corporation, and I'll talk more about her involvement in this project. We'd also like to thank the National Institute on Alcohol Abuse and Alcoholism and the National Institute on Drug Abuse for their funding support. We'd also like to acknowledge Ryan Brown, Dr. Ryan Brown from the RAND Corporation, who's a co-investigator on this project, as well as Michael Woodward, who's also from the RAND Corporation, for his assistance in the final development of our MICUNAY manual. In addition, we'd like to thank our MICUNAY Advisory Board. This is a two-site study both in Los Angeles and Oakland, California, in the Bay Area, and in Los Angeles. On our board in LA, we have Dr. Kerry Johnson, Benjamin Hale, and George Funmaker. In Oakland and the Bay Area, we have Mary Trimble Norris, Janet King, and Kurt Schweigman. We're also very thankful for our consultants who've contributed to this project, that being Dr. Kamala Venner from the University of New Mexico and Dr. Dale Walker from the One Sky Center, Oregon Health Sciences University in Portland. So today I'll be providing an overview on our project. We've just completed our first year of the project, which was spent and focused on finalizing our substance use prevention program for urban Native American youth. So primarily, I'll be presenting on the work that we've done in the development of MICUNAY, and also provide um, our plans for the rest of our research project. To provide a little bit of background. Oh, by the way, this I could take questions throughout um, the, the talk, so feel free to send any questions, and as best as possible, I'll answer uh, your questions as we go along. And I think we'll have some time at the end of the discussion as well for questions. So just to provide a little background, rates of alcohol and drug use among American Indian Alaska Native youth are high. And based on the most recent census, approximately 70% of Native Americans reside now in the urban setting. Although there are high substance use rates among urban or among Native Americans and Native American youth, and although the majority of Native Americans live in the urban setting, there are very few evidence-based alcohol and prevention programs that are specifically developed for urban youth. So we hope to address this need for prevention, alcohol and drug prevention for this population in this presentation and in our project. And what we'll be talking about today will be um, on our approach towards a alcohol and drug use prevention program that integrates both an evidence-based treatment, that being motivational interviewing, together with American Indian and Alaska Native cultural activities. And how this all came about, I'm at UCLA, and just about 6 miles from my UCLA office is the RAND Corporation in Santa Monica. I learned about Elizabeth D'Amico and her work with motivational interviewing, and we met and we talked about a potential approach on how can we integrate both an evidence-based practice with traditional Native American cultural activities. So together with her rich history in motivational interviewing and 20 years of experience in the field of motivational interviewing, and my work so far using traditional based approaches, we thought, hey, if we combine our experiences, we may be able to come up with a prevention approach that could be a benefit for um, Native American youth. So when we look at the history of Native Americans and on the health status today on Native Americans, we see that there's a unique history um, that goes with Native Americans that has influenced um, the health status of Native Americans, and that being historical based trauma. um, and which we'll talk about in just a moment. So, with um, the history of various political, social, and economic injustices experienced by Native Americans, it's placed Native Americans in a unfortunate position of being away from native lands, having been forced in many situations of being forced off native lands and and placed in urban centers and urban cities, um, and together with traumatic exposure and family histories of mental health and substance abuse, we've found that there's been an intergenerational effect where stressors that stem from um, forced relocations and various injustices have contributed towards high substance use rates and mental health problems among Native Americans. We could especially see this as it relates to um, issues associated with cultural identity, um, uh, a decrease in community cohesion within Native American population, which then ties in with a decreased spiritual base that was once stronger centuries ago. Um, so what we're looking to do is how can we tie in a known evidence-based treatment that could address the unique historical-based factors into a prevention program for urban youth. Yes, I have a question here. Will slides be available after webinar? Yes, my information will be on the last slide, and um, if you're not able to get them through this program, I could be more than I'll be more than happy to send slides to you. Just email me at daniel.dickerson at ucla.edu, and I'll send slides. No problem. So historical
And
trauma.
I will. Oh, sorry. I was just. I typically send them out to everyone who attended as well. I'll send handouts of the presentation. So I'm sorry I don't have them loaded up to the site today, but I will be sending them out in the follow-up email. So sorry to interrupt again, but please continue.
Sure, great. Thanks for helping with this. So, going back to historical trauma refers to the forced relocations of American Indians from native lands, broken U.S. treaties, forced placement into boarding schools, and other policies of the civilizing mission that sought to eradicate native ways of life and instill Western religion and culture. So, as a result of these various historical based traumas that I've spoken about, these events have resulted in disenfranchisement of the population, poor economic conditions, a loss of cultural base, and furthermore, many Native American leaders believe that problems associated with alcoholism and drug use can be traced to this sudden disconnection with traditional American Indian culture. So we believe then that there's a call for more resilience-based positive psychology approaches that to treatment and prevention in Indian country. So with Native Americans, one of the very important elements that are important in creating programs is the involvement of the community. So having community-based approaches that focus on long-term partnerships and collaboration, meaningful collaboration with the community with long-term goals and involvement is very important. For example, in a study out of um, work done among Indigenous communities in Canada, um, it was found over a 3 year or 3 decade review of reports that the successful programs um, that existed had strong community interest and engagement, leadership, and sustainability. But we know that within the urban community, the community could be very undefined, could be very difficult to see. So how can we develop and and create a stronger sense of community among the urban environment? How can we create a program, that being a prevention program, within this population? So that's one of our goals in this research project as well. And work that we've done in Los Angeles County, we worked in partnership with the LA County Department of Mental Health um, over a 3-year period, conducting focus groups and community forums with community leaders, youth, parents, providers, traditional people, LA County Department of Mental Health, policymakers, and some of the conclusions from all of these discussions was the need for more integrated approaches towards prevention and treatment programs for urban youth in Los Angeles. Furthermore, in a statewide project through the Native American Health Center headed by Kurt Schweigman, there was also similar conclusions throughout the state of California that there was a need for an integrated approach of using both traditional healing and evidence-based practices in mental health and substance abuse programs. Also, there's a study conducted out of Milwaukee, Wisconsin, in an urban environment where it was found that 38% of patients actually saw a traditional healer, and out of those who did not, 86% would consider seeing one in the future. So when we talk about traditional activities, what are we talking about exactly? So these cover a wide range of activities that um, could be could range from involvement in learning how to drum, to making regalia, to learning about your culture and language, all the way to very in-depth 7-day long Navajo ceremonies, for example. Um, we find that in the urban environment that that opportunities to participate in these activities are not common. In Los Angeles, we have the United American um, Indian Involvement Center where I work, where we do provide that opportunity for our youth. But other than the clinical setting, there are very few, to our knowledge, opportunities of engaging in your own cultural activities and learning about your own culture within the urban environment. So switching over to motivational interviewing, this is an evidence-based treatment which Elizabeth D'Amico has done a lot of impressive and leading work in, and it's a person-centered directive method of communication for enhancing intrinsic motivation to change by exploring and resolving ambivalence. So there's a spirit of MI, so to speak, that encompasses collaboration, acceptance, passion, evocation, and autonomy. And I believe you had a presentation last month by Kamala Venner, who's one of our leaders of MI for Native Americans. But just to provide a little background on some of the elements of MI, um, um, I'd like to share some of those elements in order to give some background on how we're using MI in our MICUNAY program. So with motivational interviewing, it's a approach that's collaborative. It's an approach where you engage with your client, where you listen to your client, where you demonstrate empathy. And some of the common human reactions to actually being listened to include feeling understood, wanting to talk more, liking your counselor, feeling accepted and respected, an opportunity to engage, and then being able to change behavior. You feel safe, empowered, hopeful, comfortable, and interested. You feel like you're in a partnership, so to speak, and want to come back. So we know that with drug and alcohol use prevention and treatment, what's very critical is developing and providing an intervention where people will come back. And quoting some work done by Kamala Venner, Dr. Venner at University of New Mexico, and work that she's done with the community, just to provide a quote from a Navajo female participant in one of her community-based discussions. Um, this person said, "We have to honor the wisdom in the client and then be able to see that person in the community. That's a grandmother or a grandfather, honoring them for who they are." So MI really aligns well based on reports conducted so far that aligns well with Native ways of living and communicating. It honors the wisdom within the client rather than focusing on the provider's wisdom. The client is seen as a person rather than a pathological problem. um, it's so it's an approach that thus far we've noticed has worked well with Native Americans. So what about adolescents, motivational interviewing and adolescents? Well, we have found through Elizabeth D'Amico's work that MI is developmentally appropriate. It helps teens feel comfortable. And since adolescents are always being told what to do and how to do it, and they're being feeling like they're being judged all the time, this approach is nice in that it lets teenagers take their own driver's seat to making decisions, to making healthy decisions. And it gives teens a chance to think and act independently for themselves. And in the group MI setting, this could be very useful for teenagers and is uh, useful for teenagers in that it's practical, it's cost effective, and it encourages group communication, group collaboration. It also takes a little bit of pressure off the provider in that it allows for more open discussion on important areas in substance use. So, how might we adapt MI for American Indians? Well, in general, you would want to provide MI in a culturally relevant treatment setting with appropriate decor, preferably native staff, um, using open-ended questions about culture, reflecting upon the culture um, as it relates to understanding of the problem and motivations to change the problem and ideas, um, and reflecting on how we would use our own cultural supports for change, and also exploring interests in traditional healing. These are some of the elements that would be important in the use of MI with Native American youth. You'd also want to incorporate issues associated with cultural identity, um, stressors associated with acculturation and cultural identity, and also on some of the resilience and strengths that exist with regards to having or establishing a strong cultural identity. Other important related themes would be spirituality, religion, discrimination, collectivism, and any need for other referrals. So we feel that by integrating both motivational interviewing and Native American traditional activities, that this could lead towards an innovative, development, culturally relevant program for urban youth. So we were thankful to have received a grant through the National Institutes of Alcohol Abuse and Alcoholism and NIDA, National Institute on Drug Abuse, for our project. In our project, there's really two parts to it. And the first uh, aim of our project was to conduct focus groups, both in Los Angeles and Oakland, among urban youth ages 14 to 18, their parents, providers, and our community advisory board in both locations to review relevant issues associated with Native Americans in the urban setting, and interdisciplinary program, MICUNAY, which I'll provide an overview of that shortly. So we've completed that actually. We've just completed our first year of our program where we fully developed our program. And that's leading us to our second aim of the project, which will be to conduct a clinical trial to compare MICUNAY, which is a 3-session prevention program, to a control group, um, which will involve attendance at community wellness gatherings, which will take place on a monthly basis. And I'll review these in just a few minutes. So we'll then compare outcomes between those who receive MICUNAY with an community wellness gathering participation to youth who only receive the community wellness gathering without MICUNAY. We'll see if there are any differences in in risk factors associated with drug and alcohol use, attitudes towards drug and alcohol use, cultural identity and spirituality, in addition to uh, various other measures. So during this past year, we conducted um, quite a few focus groups in Los Angeles and Oakland at the United American Indian Involvement in LA and the American Indian Child Resource Center in Oakland, and as I previously mentioned. And some of our focus group questions were the following. Um, we wanted to find out more about drug and alcohol use among urban youth. We probed into questions associated with cultural identity and asked questions such as what does American Indian Alaska Native traditions mean to you? How connected do you feel with your culture? How do you and your friends feel about your Native identity? How do you feel about your Native identity and traditional activities? And then we received feedback on our MI materials, which Dr. D'Amico's used for many of her projects in the past, in an attempt to culturally adapt them in an appropriate manner for this population. We also wanted to find out what traditional activities the youth would be interested in learning about and which ones they would like to choose for this program. And here are some of the challenges that urban Native American youth uh, uh, expressed, that they experienced. Those included cultural identity issues, uh, violence and harassment, uh, cultural disconnection in the urban environment, challenges associated with family relationships, um, substance use, and discrimination. These were the primary challenges that um, the urban youth expressed as being relevant to their everyday life. We also learned that the youth concepts of their Native identity were diverse. Overall, Native American youth in our focus groups expressed interest in learning about their culture. However, they felt that there just were not too many opportunities to learn about their culture and to engage in cultural activities. Um, some had moved or migrated to the urban setting from um, reservations or their home tribal lands. Others had grown up in the city. Some youth, we had some um, that had very little interest in culture, and some had um, had a lot of interest in learning about the culture. But in our analysis so far, most did have an interest in their culture and wanted more opportunities to learn about their native heritage. But nonetheless, there was a wide we had wide views on cultural identity in the urban setting. And also, we received feedback on our MI handouts, and our youth in our sample had strong suggestions for quote unquote urbanizing the handouts and materials. They wanted to see handouts that they could relate to that reflected the urban city environment. And going a little further on feedback we received with regards to Native identity, stereotypes were cited as being commonly experienced. Teens in our focus groups felt that they had to live in two worlds as both a native and as someone living in an urban setting. Um, and we had one individual who had no interest in our American Indian culture. Uh, and I have a couple of quotes here. One anonymous urban youth said, "Connection to tribe is person specific and depends on whether family made any efforts to ensure that their children knew about their culture." Another youth said, "You never see us represented. I'm not represented." Another youth said, "Nobody knows about Native Americans. A lot of people think I'm white. Museum Indians. They don't see us how we see ourselves." Another youth said, "Connection to tribe is person." Okay, that's my mistake there, repeat quote. But as you see, we have many Native youth in our focus groups uh, had some challenges with connecting with their Native identity in the urban setting. When we went to the topics of cultural activities and what youth were interested in, the youth in general expressed enjoying the opportunities for cultural activities. But they said in order to engage or learn about their own cultural activities, they had to do a lot of research, they had to fish out programs, and it was very difficult for them to navigate uh, the city and to find places where they could connect with their heritage. And they expressed it was just very complex living in an urban environment and finding these types of opportunities. With regards to other stressors, violence and gangs were some of the more mentioned stressors, deaths and funerals being common, urban youth expressing some fear of street violence, homicide, violence in schools, or cities. Suicides were common occurrences which they um, had experienced within their communities. One youth said the prevalent number of young people dying, friends, and even family members. Youth also expressed a normalization of substance use, that substance use was just something teenagers did. They also noted an increased prevalence in prescription pill use and using substances to numb the pain of losses. One individual said there's dope on every corner, liquor stores on every corner, so you can get high whenever you want. Now, going after we retrieved various topics of information from teenagers, we then reviewed our MI manuals, which Dr. D'Amico has used in many of her programs with youth, and we wanted to find out if what they thought of some of the topics covered in the MI sessions that we plan to use. And with the youth, we planned on providing education and information on how drugs affect the brain. So we we handed out and in the focus groups asked the youth what they thought about these handouts and how interested were they in this topic, and would they feel that this would be something other youth would want to learn more about. And in general, yes, teens were very interested in learning about the brain. We use handouts such as these. Um, and I think these were very telling for teens and demonstrated some of the effects associated with drugs and alcohol, and they thought it was very interesting to learn about how different parts of the brain light up or not light up as a result from drinking. These are more slides showing the effects of cocaine on the brain um, and the effects of cocaine after various durations of use. Youth were very interested in these handouts in general and wanted and advised that we use them in our program. We also, and I don't have, and this slide, I apologize, it came out a little blurry. Um, we had initially provided them a path of choices diagram that showed how substance use and dependence evolves, starting from um, never having used drugs and alcohol to addiction, and providing stats on um, different categories of use. Um, and when we provided our initial path of choices, the youth felt that um, it needed more of an urban feel. So here we actually use actual streets in Los Angeles and Oakland, and 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 labeled in stats associated with substance use. And the teams really liked this. When we had them come back to review the handouts and how we um, changed them to help to try to reflect and to follow their suggestions of, of urbanizing the handouts, and they thought this was great. And we, as you can see, we have the trickster coyote standing in the middle of the street, and that this will help provide kind of a way in providing a story about drug and alcohol use more in a cultural relevant fashion and in a way that youth could relate to. These are streets that they know and live in, so they felt much more comfortable with this handout. Another handout I did not include here was some normalizing handouts or providing stats on how many teenagers actually have used or regularly use alcohol and marijuana. And and the youth in our focus groups were surprised to learn that many youth haven't used or and haven't used alcohol and marijuana, and that many teenagers don't routinely use these substances. They thought this information was good as well. So then we talked about cultural activities and what cultural activities would they be interested in learning more about. And we, in our MICUNAY program, we have 3 workshops, and in each workshop, we will provide a different cultural activity group. And many different cultural activities were mentioned to us and recommended, but after looking at what was most mentioned and looking at feasibility issues, the 3 cultural activities that we decided to use for our MICUNAY program were bead making, cooking, and prayer and sage ceremony. I think surprisingly, teens wanted to learn about prayer. They wanted to learn about the traditional ways and about prayer in general, regardless of their religious or spiritual affiliations. They wanted to learn about the use of sage in ceremony. They also wanted to learn about traditional American Indian foods and also how these foods were gathered, about hunting, the use of the bow and arrow. So we've decided that we would provide a cultural activity workshop that would center on cooking, center on prayer and sage, and one focus on bead making. Now, and going to our, I think I what I did have here was our logo, but for I think it may not have transferred to the final final version, um, but we have. Um, I'm looking for it here. Unfortunately, we don't. Actually, in this conceptual model, although it's very small, you can see our MICUNAY logo in the top red quadrant. So what we also did in our focus groups was um, um, was review and provide an opportunity for our youth to develop their own logo for the program. And I may actually have a larger one at the very beginning of our presentation here. Um, yeah, here you can see our logo that was decided upon with our youth. And the youth liked the idea of using a medicine wheel, but as they mentioned with the handouts, they wanted an urban feel. They wanted something that they could relate to. So we provided them with the assistance of Robert Young, a Native American artist in Los Angeles. He came up with these great choices for the kids, and they chose to have this final logo. And you may be able to see it in this slide, Los Angeles in the lower left-hand corner, the Bay Area uh, bridge up in the upper right-hand corner. We have a pier, P-I-E-R, in the lower right-hand corner with that depicts kind of an ocean scene and some buildings in the upper left-hand corner. They thought this logo was 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 something that they could relate to. They liked it a lot, and we're actually planning on using this logo for T-shirts, hoodies, water bottles, um, for our teens to wear throughout the program, and for prizes and raffles to help create an identity to this program as well. So looking at the MICUNAY prevention program, it consists of 3 workshops. Um, and each workshop is 2 hours in length, and they occur on a weekly basis. So teens who participate in MICUNAY will attend 3 workshops over a 3-week period. The first workshop will focus um, will focus on uh, MI and making healthy choices for the brain, and a beading workshop, followed by workshop 2, which emphasizes a physical focus, and making healthy choices for the body, and learning about Native American foods. And workshop 3, making healthy choices for my spirit, which will be a spiritual focus and learning about prayer and sage ceremony. Workshop 1, by the way, will be a behavioral focus. And we spent a lot of time trying to figure how would we actually incorporate MI concepts with a traditional activity. So by using our Dr. D'Amico's handouts and approaches and manualized approach together with what the teens reflected upon on those materials and their choice of cultural activities, this is what we came up with in terms of providing an integrated approach that could kind of merge together as best as possible. I have a question here. Is it both prayer and connecting to a higher power, great spirit, youth were seeking and wanting to connect to? That's a good question. We really didn't receive um, a lot of specific um, goals that the teens had with prayer. They asked for, in general, just more of a fundamental understanding of prayer. So unfortunately, we weren't able to learn more about where they were wanting to go um, with their spiritual interests. Um, but we hope to learn more as we begin the project and actually provide the workshops. Thank you for the question. So to provide a little overview of the workshop format, they will be 2 hours in length. They'll begin with an opening prayer and smudging, if your community chooses to. Review of the basic ground rules for the review confidentiality, and then a 1 hour MI session followed by a 1 hour cultural activity, as you saw in our diagram. However, for the bead making workshop, our cultural advisors and our providers who will be delivering the intervention suggested that for the cultural activity, for the bead making workshop, that since that will require more time and due to the short 1 hour time period, um, um, it was advised that we begin the bead making session first to allow for more beading time. And if you participate in beading yourself, you know the time that's required in getting the bead set up and getting individuals to begin learning about beading. That could take some time. So for the beading, for the workshop that involves beading, we'll start with beading so that our participants could continue on with the beading as they also engage in the MI activity. That being said, this program is pretty much intended to be an introductory in nature, to provide an opportunity to begin to learn about cultural activities, education focused, interactive. But what we're trying to do is just provide this opportunity in a short period of time, but then provide links and information for the teens to continue on to other resources within the community. So in workshop one, as I just mentioned, we'll start off with the bead making activity. And so far, it's been suggested that we make a small medicine bag with beadwork. That could be feasible. Also in workshop one, we'll cover or introduce the concepts associated with the medicine wheel and how the medicine wheel is used in our project. This is the session will provide an overview of the brain activity, um, and how alcohol and drugs affect the brain. And there'll be a memory game for you to participate in, um, that will help to providing an example of how drugs and alcohol affect memory. And then, as I mentioned, handouts and links to other cultural activities. Workshop two will cover pros and cons of alcohol and drug use. We'll talk about the path of choices, the handout that uh, I reviewed a little bit earlier, use of MI rulers, and again, a review of the medicine wheel, and then Native American cooking. And so far, the suggestions have been learning about bison and salmon. So what we may do is um, our MICUNAY providers um, uh, may prepare some bison and salmon and grill these foods prior to the workshop, and then maybe teach the kids and provide an education on um, hunting and the gathering of salmon and bison, and then to teach how it was made, and then to provide taste samples. And these traditional foods, of course, are very geographically specific, so it may be different in Oakland as it would be in LA, as it would be in Alaska to Florida. So is uh, this would be reflective of your own tribal traditions. We have a question. Can you elaborate on rulers and on rulers? MI uses rulers as an opportunity to start a conversation with individuals. And one of the common uses is with regards to um, importance. For example, asking someone, how important is it for you to not use alcohol from 0 to 10? 10 being this is extremely important to you. 0, it's not important whatsoever. So if someone says, it's a 6, I, it's a 6 level of importance. So in an MI approach, it may be, oh, okay, thank you for um, sharing that with me. Why? Can you tell me why it's a 6 rather than a 3 or 4? 3 or 4, of course, would be less importance of using alcohol. So it helps to provide an opportunity to engage in a discussion um, about various aspects of drugs and alcohol. And finally, in workshop 3, um, this workshop covers in the MI session what can happen when people use drugs and alcohol, thinking ahead. And this actually includes HIV and STD risk behavior um, strategies and looking at the consequences of drinking, that being driving under the influence and risky sexual behavior. Um, and thinking ahead. So this is the last workshop. So this will help teens to kind of um, tie all the workshops together and wrap up. There will also be a review of the culture of the medicine wheel. And then here's where we'll spend time learning about sage and smudging. Um, and when we actually carry out the project, this will be on a rotating. This will come in on a rotating basis. So individuals who started workshop may come in and maybe workshop 2 for that week. So they'll do workshop 2, 3, and then 1 the next week. So it'll be a rotating admission into the program. Now, I have a question here. Would this be an activity for clients who are in inpatient treatment on a weekly basis, or would you suggest this more frequently? That's a great question. I think that due to the variety of treatment settings and treatment scenarios, budgeting, staff, accommodations, I think there wouldn't be a strict rule on this. Although in general, a weekly basis could be a good approach. But it would definitely depend on the facility and duration of the program. Um, so our next steps, or and in conclusions here, MICUNAY, we believe, represents a community-informed, integrated approach developed for urban Native American youth. And thus far, we've received high enthusiasm for the program from our urban youth. We've learned about their day-to-day stressors and areas of life that are important to them, which we feel we could integrate better into our MI approach. We've learned about what cultural activities they want to learn more about and participate in. So we're actually right now preparing for uh, beginning our clinical trial, uh, which will consist of recruiting a total of 200 urban youth, 100 in LA and 100 in the Bay Area. And when youth enroll in or sign up and for the program, one half will get MICUNAY, the 3 sessions, and a monthly community wellness gathering event, and the other half will only receive a one-time community wellness gathering event. And as we end here, this community wellness event is going to be a community-based event for the whole community, parents, general community members, MICUNAY participants, to have the opportunity to attend a presentation from a local traditional person, drummer, dancer. We even have suggestions for comedians. And tied in with a discussion on alcohol and drug use prevention. So everyone will get that once a month community wellness activity event. And then for in order and knowing that most youth will want to receive the 3 sessions of MICUNAY, if they did get only the community wellness gathering, they'll have the opportunity to come back and participate in MICUNAY after they've completed all their surveys and their group. So after we're done recruiting all of our subjects, we intend to examine changes in between the two groups, examine changes in alcohol and drug use, cultural identities, spirituality, and physical and mental health indices over a 6-month post-intervention period. Um, so as we near the very end, um, uh, I have a question. How would you suggest I best encourage these and connecting with my American youth, with me being non-native? That's a great question. Um, I think regardless, as a provider, regardless of, I feel we're all on a educational journey. I grew up in Long Beach, California, although my cultural heritage is in Wainwright, Alaska, near Barrow, Alaska. Um, I'm on my own cultural journey. I'm learning more as I go about my culture. And I think we all have to take that healthy approach, regardless of your experiences um, and knowledge of Native culture. Um, we all pretty much just have to be open and learn as we go and seek to understand our clients and the Native cultures and communities that you work in. So if you're non-Native, I would just provide that space for the teens, your teenage clients to talk about their identity, even asking them, how does it feel to, or tell me about your identity. Just asking very general questions could help out and go forward towards a good discussion with regards to their everyday life experience. And we have another question. Do you have talking circles centered for youth? I'm glad you brought that up. That's a great question. So for our educational MI session, we are planning on using a talking circle format. Our youth will sit in a traditional circular format in our sessions to help, first of all, to bring the circle together in a native way, and then second of all, to help with a good collaborative atmosphere and opportunity for cohesion for our clients. Um, Then there's another question here. How will they pick a clinical trial participants? So we're going to recruit from the community, and communities will come in, and then through basically, not literally, but basically like a toss of a coin, you get heads or tails. There'll be a program that we'll utilize that will pick uh, the condition that the participant will be involved in. So with that, I'd like to thank everyone for, um, I don't know what to say on this webinar, coming here today, for being able to attend my session, and thank you very much. And if you'd like copies of the presentation, Kate and I had mentioned that this presentation will be available on the website, and as well, here's my email and phone number if you'd like to ask me any additional questions or comment on anything further, or for a copy of this presentation. Thank you very much.
Wonderful. Thank you so much, Dr. Dickerson. There are just a couple more quick questions. Someone had asked earlier if the t-shirts you talked about would be made available for sale. Is that an option at all?
Right. Yeah, I'm not sure if we're able to do that on our research project. Um, but if you like, you could email me if you're interested, and I could see what the options would be. But thank
Great.
you for your.
Um, yeah. And then someone else asked, what are some strategies you plan to recruit the participants?
Right, yeah. So I'm glad you brought that up. That's going to be one of our anticipated challenges, since it's very hard to um, due to many, there's some bad history of research with native populations. There's a smaller population of natives. It's hard to see natives within the urban environment. So we've come up with having a youth advisory board in both Oakland and LA to help us reach out to youth. I think in a nutshell, it's going to have to take a lot of word of mouth. It's going to require us to do a good job in providing interesting interventions so that youth say tell all their friends, so to speak. So I think we're going to try the standard methods of flyers and community announcements, but we're also going to use our community advisory board, our youth advisory board, so, in both locations.
Great. Just it looks like we got just a couple more questions here. So a few more are coming in. Do you have time to take just a few more, Dr.
Sure,
Dickerson? Or
sure.
okay. Um, all right. And one of these says, with both the control and the intervention group receiving an intervention, how will you present the results since there isn't completely a control group?
Right. Yes. Well, in many clinical trial studies, you have the intervention, and you, as much as possible, provide uh, a control intervention. So in some behavior, this is would be more considered behavioral study as opposed to medication study, where you get a placebo pill if it was medication, let's say. So here you're getting a standard, what we would consider more of a standard educational uh, intervention. Um, so the control would be the one-time community wellness gathering. We feel that was the best control option possible for us, and it kind of helps us tie in with a community-focused project as well.
Great. Did you happen to mention, someone was asking, and the specific age group that you're working with?
Yes, this will be ages 14 to 18.
14 to 18, thank you. All right. And, all right, so this, one more question. So when will this be started? This person says, I work for a Native organization in the Bay Area, and one issue we have is the planning of events on the same day for youth. So as soon as the date is set, I will not have anything on that date and promote this event. Yeah, so I guess he's just wanting more information, and looks like he would maybe like to send someone to this program.
Right, exactly. Well, we're still having discussions with the organizations in the San Francisco Bay Area. Um, as of right now, we don't have a date totally solidified. So um, I see the question here. If we could definitely be in touch and try to coordinate something that could work out for your organization for sure.
Fantastic. And so another question, in our remote IOP matrix-based program in Nome, Alaska, we use intergenerational information in every session in order to make historic information available. We also have one weekly 8-hour cultural day wherein people do everything from subsistence to sewing and beading depending on the session. Still, we have the highest suicide rate in the nation, alcohol related. I'm hoping for suggestions on other from other remote areas. Also looking for traditional burnout suggestions for our Indigenous and non-Indigenous staff.
That's a good question. Yes, yeah, my family's from Wainwright, Alaska, so and I was just up in Barrow a couple months ago, working and talking and presenting at the Arctic Slope Native Association meeting. I fully understand the issues and concerns with remote, not only remote Alaska villages, but reservations throughout the U.S. It's just great what you're doing there in terms of providing education on historical trauma, having a cultural day. I'd be very interested myself to learn about how that's going in your community. So feel free to email me, by the way. Um, and I think the more we provide these types of interventions, the less um, chances we'll have of suicide epidemics in native country. I think this is a special mission of work if you're choosing to spend your career working with Native Americans, and it can be very stressful, um, especially in smaller communities where there's more intimate feel with the community and your involvement in the community and working with clients. I think it takes a special person plus smart approach towards trying to stay centered yourself. I'm sorry, I don't have the exact answer for burnout, but I think participating yourself, and which I try to do. I'm trying to drum and participate in my ways, trying to address all the four dimensions of the medicine as best as I can. But it's tough. I understand.
Well, I wanted to thank you again, Dr. Dickerson, and thank you for taking some extra time to answer all of these questions. And I want to thank everyone for joining us again and being a part of this great presentation. Since we are running over, I will just quickly remind everyone to please take our survey, which you will hopefully be sent straight to after we close out the webinar. If not, I will email the link to you, and I'll also, as we mentioned before, send out the handouts and the CEU request form if you need that. And Dr. Dickerson, if do you have any final thoughts you'd like to leave us with, or otherwise, I just want to thank you so much again for joining us.
No, thank you.
Wonderful. All right, I will go ahead and close out the webinar here, and thanks again to everyone, and I hope you have a great day.